All right. So, psoriasis is one autoimmune condition which can be very agonizing for the person who is struggling with it. The whole body gets covered with flaky, scaly, red, white patches. The condition can be very debilitating. So today we have with us MUGDHA PRADHAN. She is the CEO of iThrive, and the work she is doing in the field of functional medicine is amazing. She's a TED Talk speaker. She does energy healing, and I'm sure Mugdha, you'll be sharing yourself a lot more about that aspect of healing. So today her session will be all about psoriasis that you would need to know. The root causes contributing to psoriasis, how can you diagnose it, and then how can you treat it? And she'll be sharing a lot of her case studies about it as well. So welcome, Mugdha. Over to you.
Thank you, Rohi, for that absolutely lovely introduction. And I am really honored to be here. This is the third IFM conference. I remember us just starting off with uh, just building the association itself. So it's so great to see. And last I heard there were like 1,000 participants who had registered for this. So yay to the world of functional medicine in India. All right. I have only half an hour. I have about 3 case studies that I want to talk about, and let's see how quickly I can get through those. Sharing my screen now. Here we go. Okay, so what we are discussing today is the functional medicine or functional nutrition approach to psoriasis. We've had quite a few cases of psoriasis that we've dealt with using our approach. But before I go into our approach, just want to quickly talk about what is psoriasis. Ruhi briefly did explain it was a skin condition, but it's a chronic health condition. It involves
Can you please unshare and share again, because there is a glitch in the slide. There is a blank space here.
Okay, hold on.
Or it's Dr. Rumi. Yeah, please do it again.
Better now?
No, there's still a... Dr. Ruhi, please try, because there is a side glitch. There's an entire blank thing.
Okay.
Can you try once more, Mugdha, while I pull your presentation?
Can you please try again, Mugdha?
Yes. Working? Not working?
It's still there. It's still there.
Okay. It's something about tech in me. Like every time I do academic classes, also my slides refuse to show up.
Yeah. Please
black on screen, is it?
Yeah, it's a black thing that's coming.
Okay.
Please unshare your screen, Mugdha. So yeah, you're here. Dr. Ruby.
You can see my screen, Mugdha?
Yes, we can.
Okay, perfect.
Yeah.
All right. So the next slide, please, Ruhi. Thanks. All right. So yeah, so we were discussing what is psoriasis. So it's a chronic health condition of the skin. It involves red, silver white scales. It looks quite it's really hard to look at. And for the patient suffering from it, it often results in a lot of burning, pain, there's bleeding, there is like exudates that are coming out from it. It is an autoimmune condition which results in rapid overproduction of skins on the cell, which then leads to the formation. So it's like before the scales are shed off, there's a rapid overproduction of cells underneath, and then it leads to formation of the scales. Even though it looks quite scary, it's not contagious. And the people who suffer from psoriasis actually go through cycles of symptom presentation, sometimes based on stress, based on travel, based on the food they've eaten, based on the other factors triggering the autoimmune condition. There could be cyclic presentation of the symptoms. It affects 1 to 4% of people globally. And for some weird reason, lighter skinned people are affected more. Next slide, please. So we are not going into the types today too much, but so far, this is how different types of psoriasis presentations have been categorized as plaque psoriasis, guttate psoriasis, inverse psoriasis, pustular psoriasis, and erythrodermic psoriasis. Next slide, please. How is it diagnosed, right? Like how do people end up with a psoriasis diagnosis? The physical exam. So usually what happens is when somebody starts getting a rash on their skin, They'll go to a dermatologist, and topical creams are given. When that stops working and the condition continues to spread, they continue to go to the dermatologist. And over time, then the diagnosis, oh, this is psoriasis. Sometimes biopsies are done when there could be like if someone is suspecting that a cancerous presentation, then a biopsy is done. And if it's non-malignant, then the conclusion often is that this is psoriasis. Next slide, please. So the thing is, and I'm really glad that there are so many people who are now attending this conference, which basically means that the word of functional medicine and the way we practice is getting out, and people are aware that there is a different approach to treating any kind of health condition. But for me, like the approach that conventional medicine uses usually is more of I don't know if you guys remember these arcade games, like all these malls have these arcade games where you have this mole popping up, and then you use a hammer and then you hit it and the mole goes in, and then it feels like the that thing, that toy is not there anymore. Sometimes the approach that's used in conventional medicine feels like that, because next slide, please. What happens is the root causes are not often identified. So when a patient presents with that skin flare up, when the patient presents with so many symptoms, instead of understanding what is really at the bottom of it, usually topical corticosteroid creams are given. So even if you ask what is really going on, the usual answer is that maybe it's genetics, we don't know, and suddenly you got this disease because of your genes, and there's nothing to reverse it. And the treatment often just involves working on managing the flare-ups. So not really finding out why it's happened, but oh, your skin is looking like this. Let's see what we can do in terms of just dealing with the flare-up. Both injectable drugs are given, oral corticosteroids are often given, and topical treatments are done. And these sometimes work in the short term, because when it's an autoimmune condition, it's the immune system flaring up, and the immune system is presenting a symptom to tell you, hey, something's wrong with the body. I'm showing it to you. Figure out what's wrong so that I can go back to normal. But then the approach just becomes on suppressing those symptoms and not really looking at the overall message. So what happens there is these steroid creams, and I mean the corticosteroids and the immunosuppressing drugs, they work short term because they're suppressing that symptomatic presentation. But what we've seen also with a lot of cases coming to us, these creams, these treatments over time then lead to a lot of dysregulation within the immune system, because it's breaking the immune system's communication. And not just that, then it starts creating havoc with all of the other hormone. Because if you're going to go use a corticosteroid to suppress whatever the immune system is presenting, that corticosteroid is going to communicate with your inherent internal cortisol, leptin, every other hormone. And then downstream is going to work on your sex hormones, estrogen, progesterone, testosterone, everything is going to get affected. So we've seen that there are quite a few side effects of a lot of these hormones that impact the health. Next slide, please. So our approach, and I'm sure we've had in the last 2 days, a lot of speakers speak about functional medicine, functional nutrition, how this approach is very different, where we start looking for root causes. Next slide, please. So what we do, and a lot of practitioners in India, it's amazing how we've uncovered the potential of using advanced tests. So we use our panel of comprehensive blood tests, which is right from your CBC to your free T3, free T4, liver, kidney, all of that. But we found that in autoimmune conditions like psoriasis, doing advanced tests are really useful. We found running this test called the GI map, which is a map of your entire microbiome. We use the test from Diagnostic Solutions. That test basically is not just mapping your microbiome, it's doing a quantitative as well as a qualitative RT-PCR, and then it's telling us about what's happening with your secretory IgA, what your immune system is like inside your gut, what your calprotectin levels are like, what your enzymatic status. So it gives us a full comprehensive picture of what's happening with the digestive processes. In psoriasis, we usually also run another panel called as the autoimmune panel. This one's from Cyrex in the US. Because what we've seen is if someone presents with one autoimmune condition, it's likely that they have others. And if there is a pathogen-induced autoimmunity, then the Cyrix panel is incredible at capturing it. So we usually recommend advanced tests depending on people's symptoms, but we do a lot of testing. So before we get to solutions, before we get to, oh, here's the supplement you should be taking, or here's the food you should be eating, we go deep into diagnostics so that we understand as a individual, like this is where the concept of bio-individuality comes in. What's really happening to this human being and why are they presenting this particular illness? Next slide, please. Once we get to the root, so I have 3 case studies in which there were different root causes. So we'll talk about those. But overall, in terms of what protocols really work, in terms of diet, we as a standard eliminate all inflammatory foods, which includes gluten, dairy, sugar, processed food. And I'm sure enough speakers have spoken about that. And we focus on prioritizing protein and good quality fat along with other micronutrients. So we do emphasize on animal protein quite a bit because that's one of the best sources of bioavailable protein. But if you had to ask me what's the baseline diet for a person with psoriasis, this is the baseline diet, right? Beyond this, this is the foundation. Beyond this, then we start adding layers based on what that particular person needs, what that particular person's cultural, ethnic, religious sensibilities are, what that person's preferences are given their social life, their work, everything else. So primary protocol, eliminate inflammatory foods, include adequate protein, include good quality fat, which usually comes from butter, ghee, those who are open to eating tallow, for them tallow, and then coconut oil. For those that have a super sensitive gut and cannot tolerate too many vegetables or dals because of lectin sensitivity, or if they have a lot of digestive issues, what we found work even better, like beyond just eliminating inflammatory foods, is just putting them on a carnivore kind of a diet initially. It's like when our laptops don't function optimally, when our laptops are, there's some glitch happening, we have this boot mode where like there's this black screen and then you just run 2 lines of code like that. So our carnivore diet is our boot mode for people's health, for those of them that are open to it. Then we start layering what's really going on. Lifestyle changes, a lot of focus is put on this. Ruhi said I actually work with people on energy healing. I don't have time today to talk too much about that. But we've seen that a lot of people with autoimmune issues are going through a lot of what I call as psychospiritual chaos. Their mental, emotional health, along with their inherent lack of understanding of their soul purpose, or what are they really supposed to do here on this planet, or how they might have got caught in, like, they could have gotten caught up in society's idea of who they should be. And they're living that life, but inside the soul itself is vehemently rejecting that kind of a life, and in that conflict the body gets caught in the crossfire, and sometimes autoimmune conditions present then. So we do a lot of work on addressing psychological and emotional states and really getting to the why of their existence. Why are they even alive? Along with that, we just heard about biohacking. We just heard about things like earthing and grounding and breath work. So we do bring in these changes in people's protocols because circadian rhythm, like that is like your sleep, your light exposure, how much blue light are you getting exposed to, how much sunlight are you getting through the day, your melatonin production, that has a big impact on your overall health. Breathing patterns, like a lot of us as human beings have gotten stuck in these shallow breathing patterns because of the constant stressors that we are exposed to. So we do provide breathwork tools to people. We do have a few guided meditations that just allow people to just like maybe for 5 minutes a day, calm down and just go inwards. We do recommend and kind of get people to make these lifestyle changes, and I would say they have as much bigger role to play as much as the nutrition and supplementation. And then, of course, supplementation is required. This work that we do with functional nutrition, functional medicine, supplements do play a big role in creating a turnaround in patients' health. And supplements could be something as simple as just basic nutrients, magnesium, B complex, zinc, getting those into the body, or going more specific and deep based on the data from the advanced test. Like if someone has a lot of infections in their gut, they will need antimicrobials. If someone has, let's say, a poor microbiome balance, they will need the right kind. Like we've seen so many cases where Akkermansia levels are so low, like it's not even detected on the GI map. And then supplementing with Akkermansia just helps them. Sometimes their gut immune system is not functioning at all, right? So then we bring in things like megamucosa, so supplements that help improve the gut immune system itself. So I could speak for 5 hours about supplementation, but we supplement as required in each case. Next slide, please. So we go into some case studies. I'm running out of time. This is the first case that I want to talk about. It does have some rather gory before and after pictures. This is a 19-year-old girl who came to us with severe psoriasis on her arms and legs, even her scalp. She did have gut issues. She suffered from extreme fatigue. She was just 19. I mean, she is just 19, but she wouldn't even have the energy to get out of her house. She would just be like lying down in bed all day. And she was a dancer before the psoriasis really struck her. She used to learn Bharatanatyam dance, but because of the severe manifestation on her arms and legs, she couldn't, like, she did not want to step out. 19 also is an age where it's college, and then, you know, some humans are really mean to each other. So she was getting bullied a lot. So she did not want to engage with the world socially at all. So this is what it looked like before. Really, really nasty presentation. And like the parents could not invest in the advanced test. So we did with the basic protocol. If we can go to the next set of images. So this is 30 days. She's still doing work with us. This is 30 days into the protocol. It's literally like the psoriasis is disappearing. It's incredible how quickly her body is responding. Next slide, please. So in terms of what she's reporting, her psoriasis has reversed significantly. Pain and irritation symptoms are gone. She's feeling confident and she's ready to go back on stage. This is such a big one for her. In terms of supplements, what we prescribe, because like I said, her parents did not want to invest in advanced tests. We had to go with what we saw in the basic blood work. We did our essentials, which is your magnesium, zinc, B complex, and all of that. We did antimicrobials because through her basic blood work, I do have a screenshot of that somewhere. We saw that her infections were very high. We did ginkgo biloba, and topically for her skin, we recommended bakuchi oil. Now, this bakuchi oil we found is really effective in autoimmune skin conditions. It works really well even for vitiligo. Next slide, please. So the highest problematic markers that we saw is RDW was very high, which indicated a deficiency of multiple, like her B complex, iron, everything was low. Her HSCRP was very high. It was 6.3, like our recommended range is below 0.5. Iron was low, vitamin D was very, very low. And we've seen this, like even Dr. Renu Matani often talks about this, how vitamin D is extremely useful in treating autoimmune conditions. In her case, because of the chronic infections, her vitamin D levels were extremely so low. So not only did we supplement with vitamin D, we recommended a lot of sun exposure in different, so UVA, UVB, infrared, all the timelines of the sun. We made sure she was getting good sun exposure. We've not done a post-protocol analysis yet, so I don't know how much her vitamin D levels have gone up. But by looking at a symptom manifestation, it's a pretty phenomenal improvement. So there was fungal infection for sure. And if we had done advanced tests, maybe we would have detected candida, because in terms of her craving, she would often crave a lot of sugar. She would need something sweet after every meal. There was inflammation. Her liver was not functioning well. Gut issues were there. We will do a full-blown liver detox towards the end of the program for her. And then she also had insulin resistance and multiple nutrient deficiencies. Next slide, please. This is another case, which I'll go through quickly. We don't have before and after pictures in his because he was reluctant about sharing them publicly. So he had psoriasis, discoloration. He also had obesity, high stress, because his work involved a nighttime shift. So he worked in a BPO, and his work would start at 9 p.m. And then he also had expressed a lot of fatigue. Can we move on to the next slide, please? So in 3 months, his psoriasis had significantly reduced. We couldn't get him to change his job. Ideally, I would have done that, but he continued doing his night shift. Despite that, so many things changed. He lost 15 kgs. His energy levels improved. Stress levels went down because while we couldn't change his job, what we could help him with, manage the stress much better with meditation and all these other breathwork practices. We did give him antimicrobials and antifungals for his infections. In his case, we didn't do advanced genetics at that time. We just did like an MTFHR test because, next slide, please. When we checked, we could skip to the next slide, because when we checked his homocysteine levels, if you see the first time when we did his blood work, his homocysteine was 44.8. And we suspected there was a possibility that there was an MTFHR mutation, which was triggering a lot of his symptoms. So we put him on things like TMG, we upped his B vitamins. So we did individual like riboflavin, pyridoxine, and all of that. And we saw a significant improvement in his homocysteine levels. Of course, there were improvements in many other markers. Even his liver panel, like alkaline phosphatase, came into much better levels. His sodium potassium, that was deranged because the nighttime work was triggering a cortisol dysfunction that was weakening his adrenals. And because of those weak adrenals, his entire kidney panel was off. And then he lost incredible amounts of weight. So he was feeling really good. And no, I think someone asked if his psoriasis relapsed. It did not relapse. He stuck with his supplement protocols. Next, like either the last case study before we end. So this is an interesting one. Okay, so this woman came to us with psoriasis and hyperthyroidism. And because what happens is psoriasis is something that's a very physically visible issue. That's the thing that most people want to deal with first. She was overweight. She was having depression. She was having sleep issues. And next slide, please. So what we found out is the medicine that she was given for her hypothyroid. So she had been hyperthyroid for many, many years. The medication that she was on, one of the side effects of the medication was skin rashes and skin irritation. Now, in her case, the hyperthyroid medicine had started creating skin issues. But because she had an MTFHR mutation, which we did a test for, I think I have a screenshot somewhere there at the bottom of the slide. The next slide, I think. Yeah, this is her test data. I think the slide after that. After that also. I'm so sorry, Rui. Thank you for being my slide person. Yeah, in her case, here we saw that she also had a mutation in the MTFHR gene. So while the hyperthyroidism medicine triggered skin issues, because that was a known side effect, because she had MTFHR, the issue just didn't remain at skin rashes, it became full-blown psoriasis. So in her case, we worked on the hyperthyroidism because that was like something that needed to be addressed primarily, because her tissue was getting destroyed. Her antibodies were like in thousands. And as that started getting resolved, as we started working on very clear supplementation protocols for her inflammation and everything, as we started bringing her homocysteine levels down, automatically a lot of improvements were seen. Now, this was before, after, there was some improvement, something was still off. And that's something I want to talk about also, because sometimes when there's a chronic condition that's been there for years, in 3 months, you might not necessarily see full changes internally, right? Like if you look at, and there's a reason why I put this one, there are some parameters that improved. There were some parameters that were still in red. Why is that? Because as the body starts self-correcting, you might see some things changing, some things will need more time. So sometimes patients, or like if you're a new practitioner, you'll be like, oh, why didn't it work? Like the patient is reporting so many improvements. Externally, things are looking great. Sleep is great. Energy levels are great. They've lost weight. Why is the internal data not reflecting that? Because it takes time. God knows for how many years that internal data was off before the disease started manifesting externally. So it takes time for the internal data to show all the positive changes, but it happens. Like if you track over 3 months, 6 months, 1 year, you will see over time it really starts changing internally. I think we can move on. Yeah, here there are some other improvements. So basically, just summarizing in the last couple of minutes that I mean, this was just a quick presentation on psoriasis. We've now, in last count, worked with nearly 174 different diseases. What repeatedly I learned from all the work that we're doing is that unless we learn to look at the root causes, physical root causes, of course, deficiencies, toxins, infections, whatever is triggering the disease, unless we look at whatever are the psycho, spiritual, emotional root causes, what is really going on in this person's life. Because every condition is multifactorial. It's not just genetics. Someone's genetics could be predisposing them towards, let's say, something like depression. But if they live in a collectivist culture, if they're not alone in their life, if they did not have any childhood adversities, maybe they won't really manifest that issue versus a person whose genetics might not really have that much of a possibility, but they faced way too many childhood adversities. They had extreme trauma. They do not have a social network that supports them. They do not do the work that they love. The possibility of them manifesting an illness is much higher than someone who might just be genetically predisposed to it. So the nuance of our practice now, when I see a lot of practitioners in the Indian functional medicine group incorporating all of this knowledge together. I mean, the conference speaker list itself is a reflection of that, everyone is understanding it's not just about supplements. It's not just about food. It's about really understanding the human being for who they are and using a multifactorial approach instead of just trying to suppress the symptoms, instead of just saying, oh, let's stop this illness by just giving this medicine. So that approach will never work. It's short term. It might be okay for an acute presentation. Someone had a severe gut infection and they're like throwing up and they have diarrhea. Maybe at that time, allopathic medicines are the best intervention. But if you really want to treat a human being and make it a sustainable change for them, then it's long term and understanding them as who they are, that really creates a change. So thank you so much for your time, you guys. Thank you, Ruhi, for helping me with my slides. And I hope this was useful.
Welcome.
Yeah.
Absolutely. Um, you know, it's amazing the improvements, the impact that you've created with these with these clients. Let's take up some questions. So
Sure.
you mentioned about antimicrobials, antifungals. Can you elaborate a bit more on what kind of these have you used?
Yes, so we usually stuck to herbal because I'm a nutritionist. I'm not a doctor, unlike many of you guys. So I can't even like do prescription work. So we use something called as biocidin early on for the last year and a half. This month we launched our own antifungal. If Suyash was here, I don't know if he's there in the audience. He's our mad scientist who creates a lot of new formulations. But we stick with herbal ones. We stick with herbal antifungals or we stick with herbal antimicrobials. The so biocidin from the US was great, but was super expensive. Getting it here was difficult. That's why we started making our own antimicrobial. We also have an antifungal. So these are a mix of different herbs. Now, getting to the that's again a I think 2 hour talk, understanding how different, like if it's a fungal thing,
Absolutely.
pau d'argo really works well. Oregano oil works well across a broad spectrum of infections. But it's herbal. We work with herbs.
Yeah. And do you have anything to say, when we address these infections, right, especially the fungal infections, die-off reactions can be another big thing
Yes.
to
Yes.
counter,
Yes.
right? Any suggestions on that?
So we usually bring in binders. Activated charcoal is our baseline. That's like a must so that the
Yes.
herx is prevented. But then depending on the intensity of infection, sometimes we also recommended things like modified citrus pectin, psyllium husk. And often what we do is in cases where we see the gut is really weak, digestion is really bad, and they have a lot of infections, then we first start off with the binders itself. Like we load the body with binders, even chitosan. So there are many binders that we use depending on the intensity. And then we start giving in these, and usually we do one at a time. So if someone has bacterial, fungal, parasitic, and viral infections, we start off with H. pylori. If they have H. pylori also, we start with that. Then we go on to the next. Then we go on to the next. And then usually the binders, like if someone has a mold issue, the binders are anyway dealing with that. So binders have a big role. Detoxification has a big role. Everything has a big role. Like you can't do one
Yes.
thing.
And it cannot be done in 3 months. Definitely not.
Cannot. But
Yes.
you can get somebody started.
Absolutely. Yeah. So thank you so much, Mugdha, for sharing your experience and insights with us. If you have some time, please do stay back and answer a few questions.
Yes, I will. So on the chat, it's okay to answer, right?
Yes. Yeah.
I will.
Okay. Thank you so much.